Can you give me the latest information that you have when it comes to the outbreak in Sydney?
New South Wales authorities are investigating. Their working theory has been a link to Victoria. I understand they're close to making a definitive judgment on that. But it's not surprising. This is one of the reasons why the Prime Minister, the two Premiers, New South Wales, Victoria, made the very difficult decision together to quarantine Victoria to help protect the rest of the country. And they've acted, but it will be difficult for Victoria and for other states. But these are the important steps.
Yeah, I mean, I was going to ask you that if you were satisfied that that Sydney outbreak did come from Melbourne. It seems fairly obvious, doesn't it?
That's the likely advice, but we don't have a definitive answer yet. But I understand that New South Wales Health is very close. They may be in a position today to make a definitive judgment, but it's clearly likely. New South Wales has done incredibly well. They've had close to zero transmission over much of the last month at community level. That's now changed, obviously, with this case. But they are tracing down and tracking down every case, all the contacts, and that's the critically important thing.
You must be troubled by those numbers in Sydney, though, because they are steadily increasing, and it kind of supports what usually goes on. It starts small and gradually increases day by day.
We are incredibly focused. I know that the New South Wales government is. We're in contact with them every day. We're working with them. They are, however, very, very professional at the tracking and tracing. The Chief Health Officer there, Kerry Chant, she and her team, Brad Hazard and his ministry, they have in place really one of the most developed tracking and tracing systems, not just in Australia, but within the world. And so that's giving us the best chance to find all of the contacts.
And when it comes to Victoria, what's the latest information that you have out of Melbourne? And also, there has been a move, and the Victorian Premier has suggested that more restrictions may well be on the cards. Do you think that that is necessary?
So the level of restrictions will always be determined by the number of cases and the direction of cases, where the cases are growing, whether they are on a path to significant expansion or whether they're stable. It's in the balance in Victoria now is the honest answer. The Victorian government has clearly and deliberately not ruled out the potential for further measures. Our goal is to drive these numbers down, to flatten that curve again, because we've done it. We're now pumping 1,000 ADF members into Victoria to assist with a variety of tasks, but perhaps most importantly, very senior military leadership to assist Victoria inside the tasking element of the tracing program. So in other words, to help make sure that each person is traced every day where there has been an outbreak. So if somebody's identified, we know that they're being contacted, and we know that we are tracking down all those people with whom they've been in contact. That's our fundamental federal concern, which we're pushing in Victoria.
Yeah. Now, you did mention the goal here is to flatten the curve. You'd be aware that the debate is now coming back into play about elimination versus suppression, because there seems to be some confusion about what the federal government wants and what some states want. So just for clarification, is elimination off the table?
So our national goal is suppression, to get as close to zero as possible. When you ask people what do they mean by elimination and do they understand what that means, if you say, does that mean you're in favour of no
zero
right
cases,
to protest, no right, all borders closed domestically, no humanitarian returns, no trade with overseas, no family reunions of people returning from overseas, completely hermetically sealed nation, people walk back from that. And so it's very important to understand that when somebody says that, they are effectively meaning there are no returns from overseas for Australian families, there's no humanitarian reunification, no family reunification, no trade, no trade between the states. Those are the real consequences. Yeah. So if somebody asks about that, please put it to them, is that what they're actually proposing? Because you cannot have that sort of proposal in this world with over 13 million cases without actions on that scale.
It's impossible, isn't it? Elimination.
Well, we just need to be honest, and I think that's our important point, that we have set out to be absolutely honest with the Australian public. I know New Zealand talked about it. They've done fantastically well as well, but they've had many cases since they said that they'd eliminated it. And I'm not being critical. They've done a great job. Australia has done a great job. We had 0 cases in Victoria until there was the outbreak from hotel quarantine, not within the community. And what you can see is that unless you ban Australians from returning to Australia, unless you ban trade, because it could be secretly with a crew member who has contact with somebody else, then nobody can make a promise, and what we won't do is make a false promise. And one of the important reasons, of course, is we want to remain vigilant. If you're closer than 1.5 metres, if you can reach out and touch somebody else, then you're at risk of either transmitting or receiving the virus. We need to maintain these disciplines because in a world with over 13.5 million, over 13 million cases, heading towards 20 million inevitably, this is a global pandemic.
I've only got about 30 seconds left with you, Minister, but I just want to ask you, do you have any concerns that ongoing restrictions, the cost of ongoing restrictions outweighs the health benefits?
Well, we know that in order to make the economy work, we have to reduce the virus as much as possible. That's what will actually allow the economy to return to its best state. It won't be exactly the same as it was, but if we can reduce the virus to as low as possible, we protect lives, we save lives, but we also best protect livelihoods.
OK, and just finally, I've got to ask, have you received a ribbing from your family and friends over not being able to put your mask on properly the other day?
Oh, look, my wife was so disappointed, and she's a very private person. She made her own instructional video as to how to put on a mask properly. So the whole family has declared it an epic fail. But importantly, as somebody wrote, it was unintended marketing genius. As my kids said, that's genius with a J, Dad. But it did mean that people were talking about it. And we should be wearing masks if we can't social distance within the Melbourne area in particular.